Dr. Priyah from My Dental Care. Hi, good evening. I'm Dr. Priyah from My Dental Care, Sri Kambangan and Puchong branch. Today, I would like to share small information regarding something which is very important for every patient to know, something about crown for a tooth. So, what is a crown? Can show the picture. So crown is basically a protection or a cap given for a tooth. It will actually, when is it needed? It is needed when the tooth needs protection, when the tooth is weak. So for example, like crown is used to protect or to cover or to restore a structure of a tooth when a normal filling cannot help or resolve the problem that the tooth has. So how is it done? Next picture. Yeah. So let's say if your tooth is broken, more than half the tooth structure or half the tooth structure is missing. So crown would be indicated. Let's say if it needs a root canal treatment to be done, or even on a vital tooth crown preparation, it can be done. So basically, they will reduce the size of the tooth and then place the crown in order to get an exact shape of your original tooth structure. So when does a patient actually require a crown? Number one, when the patient has cavity, like how it is shown in the picture, and it's very deep and a normal filling cannot restore the tooth. Another one, when a root canal treated tooth, if Gigi tu pernah buat rawatan akar, the tooth becomes very fragile. So you need a protection so the tooth can last long. So the protection, the best protection you can give for it is placement of a crown. Or let's say if the patient has injury and your tooth structure is lost, like you had an accident and half your tooth structure or less than half your tooth structure is gone, but it cannot be restored with the normal filling, it doesn't really last long, you can go for a crown. Or let's say for elderly patients when their tooth becomes very sensitive, yang gigi tu hakis pada permukaan atas rasa nilu, so you can protect your teeth with by placing a crown on it. And other than that, like for some patient when their teeth is very much yellow or it's in a different stain tooth, it's not white color and they don't like the appearance of the tooth and they want to change it, you can actually place a crown on it. Next picture. Next picture, please. Yeah, something like this. Like when you have space in between your teeth and you think you don't really like your teeth color, you can actually replace it with a crown and it looks really natural and it looks really beautiful. So crown can be used for many reasons, and if you think you require a crown or if a crown is needed for a patient, you can actually come and discuss with your dentist. And there are many types of crown. There is metal ceramic and there is zirconia crowns. There's variety of types that you can come and discuss with your dentist and they will give you the best option needed. And thank you. That's all. Aesthetic based crown placement. So the patient didn't really like the tooth shape and the color of the tooth. So he requested for a change and full mouth smile designing was done for the patient and crown was placed for all the tooth, individual crown. So if you would like to get a crown done for your teeth, you can come to My Dental Care. Any of our branches or Sri Kambangan or Puchong branch will do it for you. Thank you.
Hai semua, jangan lupa like FB My Dental Care, follow Instagram My Dental Care dan juga subscribe YouTube channel My Dental Care. Captain Gigi to the rescue.